Hello, I'm Tor Andreasen, and thank you for tuning in to watch this video on our work entitled The Influence of Ligament Injuries on Wrist Contact Pressure via Monte Carlo and Finite Element Analysis. So here are our relevant disclosures as well as our relevant funding sources. So a little bit of background. Scapholunate ligament injuries frequently occur when falling on an outstretched hand and may cause significant pain and a decrease in quality of life in those affected. When not treated properly, these injuries can progress to scapholunate advanced collapse pattern osteoarthritis and may necessitate more severe surgical interventions. However, the method by which these injuries progress is not well understood, particularly between individuals. While finite element analysis has been used for other joints to understand the progression of OA from soft tissue injuries, it's not widely been used in the upper extremity, and moreover, the few models that do exist have long run times, and as a result, as you can see here, the models rely on average material properties and do not account for individualized patient-specific behavior. So the goal of this work were twofold. We firstly wanted to develop a set of finite element models with improved computational speed over those previously created. Secondly, we wanted to use these models to investigate the effects of different ligament injuries, either in combination or in isolation with one another, on overall radioscaphoid contact pressure as a means of a potential OA injury mechanism. So this work began with a data collection captured with two age and sex matched asymptomatic participants that were collected with four-dimensional CT while performing a variety of tasks, and these CT volumes were then segmented to create the bones as the basis for the geometries for the finite element models created herein. Soft tissues were then predicted by using a template model taken from the literature with known cartilage and ligament attachment sites, and then using a publicly available morphing algorithm. These bones were then morphed to the bones of our subjects, and in the process could be used to predict the cartilage surfaces on our subjects as well as the ligament attachment sites. This was then repeated for both subjects to create two finite element models shown here. These models are then used to predict flexion extension by simulating overall capitate motion and observing the motion of the scaphoid and lunate therein, and can predict ligament forces as well as radioscaphoid contact pressure, which is the main focus of this work. Monte Carlo analysis was then used to simulate these models under a range of material properties taken from average distributions from the literature, as well as could simulate random combinations of joint injury to the primary scapholunate ligament stabilizers. These were then used in combination to simulate many flexion extension curves and could predict the radioscaphoid contact pressure under different combinations of material properties as well as injury conditions. So some basic results. Our models were successfully able to run in approximately 45 seconds, allowing for 22,000 Monte Carlo simulations to be performed, which can result in approximately 5 million data points for a generalized linear mixed effects regression model. The generalized linear mixed effects regression model, shown here, shows that the radioscaphocapitate ligament, shown in pink, was the only ligament that showed a significant increase in the average radioscaphoid contact pressure of nearly 50%, regardless of the state of the other ligaments. So what this study demonstrates is, firstly, it shows the feasibility of a subject-specific finite element analysis model combined with Monte Carlo analysis to assess the contributions of individual wrist ligaments in the presence of subject variability on radioscaphoid or other contact pressure. Secondly, it shows that while the dorsal scapholunate interosseous ligament is thought to have the greatest contribution to scapholunate stability, the radioscaphocapitate ligament, in contrast, may be more directly associated with increased radioscaphoid contact pressure and may demonstrate a possible injury mechanism towards overall wrist arthritis via injury to the surrounding extrinsic ligaments that stabilize the scapholunate joint. So thank you for listening, and if you have any questions, feel free to contact me at this email.